Wow, it's so great to see a full room. So good afternoon, everybody, and welcome to the State of the School Address. My theme today is going to be teamwork, so I'm going to start by thanking my team, the communications team. You'll notice the format this year is quite different. Took a lot of effort, so I want to thank Mason Essef, Angela Spivey, Andrea Martin, Ann Davis, and Stephanie Loud. So thank you for putting this together. And I'm not going to say if you don't like it, blame them. But anyway, as with each year, it gives me immense pride to review all of your accomplishments, my colleagues, our students, our friends, and our staff. And one way to illustrate our success is by highlighting the many ways that you all are recognized, both within Duke and outside Duke. In other years, as you might remember, I go through a massive list of names and pictures, and I usually avoid pronouncing the names because I'm bound to pronounce a few wrong. So we're trying a different format today. It's really a montage of all of those recognitions, and granted, it doesn't represent everything. It gives you a flavor of how you all are recognized for your excellence. So with that, let's watch the first video. And as I said, that is just the tip of a very large iceberg. These awards recognize the individuals who have accomplished incredible things. But every one of them, as I'm sure they would tell you, accomplishes what they do because they are members of a team working alongside students, staff, and other faculty members. So today, I want to talk about team medicine. It is integral to the successful scientific discoveries, clinical innovation, educational excellence, and effective community partnerships. It is at the core of all of our successes. And I think we lead the world in that regard. I'm going to show you how that magic happens by telling our stories. The stories will tell not only what we've accomplished, but what stories will define our future. And that, well, there's only a few stories I can tell. I think they capture the breadth and depth of the teamwork that really defines our school. They will illustrate just some of the amazing innovation we're making in research, education, community partnership, and clinical care. And as you'll see, all of our missions support each other. They are integral and integrated in a way that it's a virtuous cycle where one facilitates the success of the other. And that's another point I want to make today. We can never lose that integration. As much as one day we might focus on our clinical mission, another day on our research, what makes Duke great is the fact that they are all integrated in a single institution with a shared vision for how we can really have the maximum impact on health. So, let's start with our extraordinary research mission. As I mentioned, teams are what make us successful. They deliver our discoveries from the lab to the world. Every day, teams come together, rallying around a new idea, an innovation, a discovery, and they transform that into advances that ultimately affect people's health. So I'm going to tell some of these stories. Up until recently, women with advanced breast cancer had very limited options, and those options were painful monthly injections, just to keep the disease at bay. A team of researchers in our pharmacology and cancer biology department, led by Donald McDonald, have been looking for a better way. For 30 years, his team has been trying new ways to dampen down response to estrogen. Estrogen is the main hormone that fuels certain types of breast cancer. In fact, early work by graduate students in the lab, John Norris and Carolyn Connor, demonstrated that if you can induce changes in the estrogen receptor, you could force internal receptor migration and inhibit growth of the tumors in mice. The basis of drugs, now called SERDs, or selective estrogen receptor degraders. But it wasn't until 10 years ago that trainees Suzanne Wardle and Eric Nelson found that an existing drug developed to treat hot flashes, which apparently didn't do very well, otherwise many of us would be on that, they discovered this had the potential to act as an effective breast cancer drug. After they discovered that it leads to that recycling of estrogen receptors, they had to then show proof of concept along with other investigators, and they did show that in mice it did indeed stop breast tumors from growing. And then they had to persuade the company to support the clinical trials for this drug. The team finally realized its dreams when earlier this year, these trials resulted in FDA approval of the first new drug in years. The new drug is more effective and certainly easier to take as it's an oral formulation than standard care, and it gives patients a better chance. A true team effort. And another great story, this is the story of baby Owen, and I think the world has fallen in love with baby Owen. In another extraordinary example of teamwork, a Duke team in collaboration with investigators at the Medical University of South Carolina came together to tackle a problem for babies with congenital heart defects. Babies born with heart valve defects face years of multiple surgeries to implant new valves as the heart grows. You can imagine over and over, families have to endure the worry, the risk, and recovery that comes with each of those major operations. So this research team asked, what if we could fuse living arteries and valves onto an infant's existing heart so they could grow with the child? After testing and modeling, investigators started a clinical trial and prepared to deliver this innovation to a baby at Duke. They created customized methods in which they would transplant the roots from a normal donated heart, including the valves, into the recipient's heart. In 2022, Duke's chief of pediatric heart surgery, Dr. Joseph Turek, and transplant cardiologist Michael Carboni performed the world's first partial heart transplant in a 5-pound newborn, baby Owen. They worked alongside a skilled team of anesthesiologists, nurses, technicians, and support staff. So far, the results are amazing. I think we're well beyond 14 months, and the baby is thriving. This procedure is truly a game changer and can save lives of countless children. And in fact, the second and third partial heart transplants have been successfully performed. Another example of a breakthrough that happened here at Duke because of the great teams that came together to make this magic happen. Another example is really looking to the future. As most of you know, we started an initiative called Duke Science and Technology Initiative 4 years ago now to attract a new level of scientists to Duke, not only for their science, but people that really came here because they could execute team science, the DST initiative. When cross-disciplinary teams unite, science advances, and this philosophy is at the heart of the work that we do today. Pictured here is just one of those scientists, Dr. Shuo Han from the Department of Biochemistry, who collaborates across Duke to study the fundamental question of the role of the human microbiome in healthy aging. She is one of 9 faculty who have been recruited to date under DST, all of whom exude this spirit of collaboration. And teamwork also fuels philanthropy, which then fuels our research mission. Recognizing a need to provide a dedicated time for research to help people with ALS, several patient families came together, united around a goal to raise enough money to fully fund an endowed professorship. They chose Duke because of their love for our ALS physician and researcher, Dr. Richard Bedlack, noted by his classic shirts, pictured here in one of his signature outfits. These families mobilized their personal networks and generated support from more than 500 donors, most of whom had never met each other. The families that started the effort named the professorship in honor of the loved ones they had lost to ALS. But it is the love for that physician that really galvanized them together to create this professorship. Their story reminds us there is a role for everyone today to play in the next philanthropic campaign as we tell our stories, and that campaign will launch publicly in 2025, and you will hear a lot more about that. So I could tell lots and lots of team stories and research, but I need to move through our other missions. So what about education? Innovating in education is an ongoing process. Duke School of Medicine has long been known for its innovation. In fact, over 50 years ago, the curriculum was changed in the MD program to have a full year of scholarship in the 3rd year. That has not changed, and now we've seen, after 50 years, other schools adopting that, at the time, innovation in medical curriculum. But medical curriculum is not static, and in fact, we started a process 3 or 4 years ago, maybe 5 years ago now, to really look at our own curriculum and say, how can we better prepare our students for medicine of the future? And that resulted in a framework of a whole new curriculum that we're in the process of rolling out. That curriculum, named the Patient First MD curriculum, has many components, and this year we're rolling out what's called the Pioneer Program. This is recognizing that the traditional way of training future physicians in the hospital does not represent the practice of medicine today, which is mostly in the ambulatory setting and really helping to prevent and manage chronic diseases. So the Pioneer Program starts to really embed that training within our MD program. To prepare for this challenge, the 2nd-year students go through a 16-week rotation in outpatient clinic to learn how to manage chronic diseases like diabetes by following the patients, working side by side with the providers over time in the ambulatory setting. This has been a true team effort with more than 50 faculty involved in developing the curriculum, and you could ask yourself, why is it so complex? Well, anything you do in an MD curriculum is complex because you're trying to fit something in to a structure that has to do a lot. And so it really does take effort to figure out how do you do something as dramatic as a 16-week new curriculum. Providers from pediatrics, internal medicine, OBGYN, neurology, and emergency department are all participating with over 110 clinical faculty, MDs and APPs, who will serve as preceptors. We are so excited about this and really think it starts to define a new model of medical education. And of course, we have many health professional programs to be proud of, and our latest one is a new program, a doctorate in occupational therapy. To develop this new doctorate curriculum, Barb Hooper assembled a team of practitioners, entrepreneurs, educators, and scholars from Duke and across the country. The group analyzed data, evaluated educational models and theories, and studied Duke's institutional values, including innovation, leadership, collaboration, and diversity, to come up with a new program, again, the first of its kind program, our new occupational therapy doctorate program. So this program is off to an amazing start. I had the real honor of welcoming the first class of students, I think it was 2 years ago, I'm losing track of time, and it was just amazing to see this diverse, passionate group of new occupational therapy candidates come here to learn. The current class of 2023 has 44 students, 20 are underrepresented minority, 41 women, 3 men, 13 states represented. So really, really representing diversity. But rather than me tell you about the program, let's watch a video and hear from the first inaugural students.
Getting into Duke was a really big step for all of us. I'm sure everyone feels the same way, a very big accomplishment.
In any form of healthcare, it's very important to have a tight-knit family and work together to solve problems. So today we're joining the two classes together to make a great class of future occupational therapists.
So I look forward to seeing the next stage of this program, and we have passed the first level of review for certification of the program, actually with flying colors. So when we talk about other parts of our education program, we really are starting to think about how do we better support our students. And in fact, about a year ago, we engaged a number of our faculty, students, and staff to come together to talk about how do we better support our students in what we called reimagining student support. The short-term vision emerged that students in all programs should have equal access to support services across our training programs and should know exactly where to access them, starting in 3 key areas: mental health, disability accommodation, and learning skills. And so now we're starting to see the rollout of that program. So I want to start just by thanking Nancy Knutson for her service as the outgoing Associate Dean of Student Environment and Wellbeing, and welcome our new leader in that role, Dr. Jane Gagliardi, who will be the Associate Dean for Learning Environment and Wellbeing starting July 1st, and will oversee the rollout of the ideas that came up through that reimagining student support. In conjunction with the directors of all our educational programs, Dr. Gagliardi will develop a cohesive plan for support services for students in those 3 key areas. In addition, she will start creating a School of Medicine office of student service that's centralized and will standardize resource availability to all of our students and ensure equitable access across the school. Such a one-stop shop of services for all health profession students would make our school, again, a national standout in this area. So again, philanthropy is part of our teamwork in our education domain. And in fact, we have a great example of team efforts in philanthropy when a team of some of the most committed ambassadors for the School of Medicine, the School of Medicine Board of Visitors, came together last year to show their support for our students. Based on an idea of one of the BOV members, 8 members came together to create a BOV scholarship fund. And in fact, 2 others have funded scholarships on their own. So without philanthropy, there's no way we can remain tops in education, and we are so appreciative of these efforts. So now let's talk about community partnership, one of our 4 core missions. We learned during COVID the critical importance of that relationship between Duke and our community. And I would argue that that's one of the areas that we really learned how to do it better during COVID. And in fact, one of my key messages to my team is let's use that learning experience to continue to forge this critical partnership with our community. And there are many great stories to tell in that regard. So one partnership is a partnership to improve women's health. Here's an example of how our medical community works with a Durham community partner, in this case NCCU, to make sure our work is relevant to the lives of the people that we serve. Here you see Dr. Frederick Jays from Duke and Darlene Taylor from NCCU. They came together to create a potential new therapy for uterine fibroids, which disproportionately affect Black women. The collaboration grew out of a formal community partnership with NCCU, which is now in its 5th year. And in fact, this is the central theme of our CTSA, that partnership between Duke and NCCU. The pilot study that was supported initially through CTSI funding showed proof of concept, and now that that is completed, further external funding has been secured. And this is an example of the important partnership with NCCU, a centerpiece of our CTSA. So there was a whole team involved in getting this work off the ground, and we look forward to hearing the future about this promising injectable therapy. And in another partnership with the community, we really focused on enhancing participation in clinical trials. Here, we see that 13% of our US population is Black, and yet if you look in cancer trials, only 7% of cancer clinical trials participants are Black. That has to be corrected. We have a history of FDA approval of drugs that have not been validated in broad communities. This work is incredibly important, and Nadine Barrett is really making headway with colleagues across the campus developing a program called Just Ask to address this disparity. Just Ask really seeks to educate community members about clinical trials and to educate our faculty and staff on how to have those conversations with an eye towards recognizing implicit bias and to foster better communications with underrepresented people in our community. But let's hear Nadine talk about the program.
We know nationally that people of color, particularly African Americans, Latinos, and Asians, are not represented in clinical research and trials to the same extent as their white counterparts. So the Just Ask program is specifically designed to be able to think about and help research teams to be more effective in how they engage diverse populations in simply asking them to participate in research and clinical trials, but not just participate in the recruitment, but also retain them as an ongoing volunteer and partner in the research world in which we live and we work every day.
So Nadine's program has really taken off. And in fact, not only is it part of the Duke Cancer Institute, the CTSI, and Duke Office of Clinical Research here, it is now being adopted nationally and trademarked by the American Society of Clinical Oncology and the Association of Community Cancer Centers. In pilots in 49 states, anywhere from 19 to 45% demonstrated an increase in staff knowledge on implicit bias, along with an increase in knowledge of strategies to address bias and trial diversity, necessary steps in increasing participation. This accomplishment is yet another example of how teams are leading the way to forge healthier, better partnerships with our community. And looking to the future, one of the partnerships with our community I'm really excited about is a program called Project Nourish. This project was made possible by an estate grant. I love the story. It was somebody that had no connection to Duke whatsoever, and yet in her will, she left a very significant estate to Duke. And why? She was interested in nutrition and prevention. And we've tried to make the connection. We can't figure it out. We're not sure she was Googling at 95, but we think she might have known that we were doing work in this area at Duke. And so Sarah Armstrong came together with Chris Newgard to come up with a project that is in partnership with the community to understand the intersection between food insecurity and childhood obesity. The project is truly a community partnership, as the scientists are spending their first year strengthening ties within the Durham community and working with families to develop meaningful interventions. And we are looking forward to hearing more about the future discoveries, including impact on health policy. No pressure on you, Chris. But I want to take a little bit of a detour now, before I recognize some other extraordinary teamwork. I want to recognize some of the people who are absolutely critical to all of our successes, but often unseen, and that is our staff. This year, I wanted to create a new set of awards, the Dean Staff Awards. I want to thank Katie Boyd and Nick Jeffries, two members of our human resources team, who took that idea and ran with it. As I have watched over the years how much our faculty value the coveted annual faculty awards, I wanted to create a similar highly valued opportunity for our staff. Katie and Nick took this charge, leading focus group sessions, reaching out to other institutions, compiling feedback, all with very little lead time. They did an exceptional job, and I want to thank them. I also want to thank the selection committee that went through 200 nominations from their colleagues for this year's first staff awards. And let's take time to recognize the first recipients of these awards. The Dean's Excellence Award went to Allison Taylor, a talented physician assistant who has provided exceptional mental health services to thousands of underserved youth and their families for more than 20 years. The Champion of Inclusion Award went to Deborah Ragland, who took over the leadership of the BioCorps Graduate Student Diversity Initiative in 2022 and has provided a safe, fun, and respectful place for students from minority backgrounds to feel like they belong. The Valued Service Award went to Caitlin Hicks, a program manager with the Department of Orthopedic Surgery. Her work impacts students, faculty, and clinical staff, and one of her nominations wrote that their team couldn't function without her. And then the Professional Integrity Award went to Jessica Schonberg, who has been instrumental in developing highly sought-after and valued faculty leadership development programs. These staff members represent the excellence, leadership, and dedication we see and actually we benefit from every day in the School of Medicine. We have the honor of having Deborah, Allison, and Jessica here. Can you stand so we can recognize you? And Caitlin's here anyway, so thank you for showing up, Caitlin. So moving on to patient care as one of our core missions. We see teamwork every day in the delivery of the excellent care that our people provide to individuals with very, very complex problems. So I want to give you just a few examples. So with the good news of longer survival of patients living with cancer, one of the unfortunate outcomes is metastatic disease, often to the spine and brain, which can be devastating. Often these patients are told at that point there are no treatment options, but not at Duke. By combining expertise across dozens of areas of medicine, the Center for Brain and Spine Mets offers some of the most advanced surgeries and treatments for these very challenging cancers. Specialists in this center provide new hope. And in fact, more than 50 clinical specialists have come together. New patients that are seeking care are seen within 72 hours by all the specialists that are pertinent to their care. So far, we've seen more than 2,000 patients having been navigated to care since its launch. The center has quickly become the most comprehensive destination programs in the country for this growing population of patients. And now I want to talk about perhaps the biggest team effort we've had in a number of years at Duke. So to deliver that kind of teamwork for the multidisciplinary care that is required by many of the patients we see, we really had to develop a new model. And so we are going to see July 1, the launch of what's called Duke Health Integrated Practice. This has been a very heavy lift. But by creating DHAP, as we call it, our team of clinical faculty and staff had laid the foundation for Duke's future of patient-centered care. And without getting too much into the weeds, we are creating a single organization that provides that care. Historically, and many of you may not have even known this, that kind of integrated care was provided by different organizations, the PDC, separate from Duke Health System. And in fact, that created many difficult barriers to really achieve patient-centered care. So with lots and lots of work, we have reached this exciting milestone, probably 95 years in the making. And I want to acknowledge all the hard work that has gone up to this point across Duke Health. And when I talk about Duke Health, I'm talking about the School of Medicine, the health system, and the PDC. This transition has required tireless dedication particularly from our administrative staff across 17, soon to be July 1, 18 departments with the new Department of Urology. Change is never easy, but absolutely necessary to remain a leading academic health institution. We are poised to move forward to leverage the remarkable expertise and resources at our school and in the health system in ways that were simply not possible before. Looking to the future, united under one umbrella, we can achieve the potential of team medicine and reach new heights in all of our missions, whether delivering on the promise of population health and patient-centered care, translating our discoveries from the lab bench to the bedside, attracting and training the very best future providers. It will be easier as one entity. With DHIP in place, we can make strategic investments so that our patients will receive better care, better and coordinated care. In turn, our communities and populations will become healthier, and we can move closer to our goal of true health equity. Duke Health will be recognized across the country as a premier health institution. And I want to end by a team effort that goes across all of our missions. As part of our Moments to Movement strategic plan, a faculty committee reviewed the processes of promotion and tenure and made recommendations for integrating equity, diversity, and inclusion into the fabric of this process and all aspects of this process, something that has now the acronym JEDI. On this side, you see the four faculty who presented this project at the AAMC, as well as our EDI team. At the heart of this effort is the desire to recognize the full breadth of Duke values and to magnify excellence across the breadth of our faculty. I'm going to let Kevin Thomas, our Vice Dean for Equity, Diversity, and Inclusion, to talk about these team efforts.
When I think about change management and how really transformational change occurs, it really is through partnerships and collaborations. Like no one individual, no one team can do it alone. And so I really invested in time getting to know people, developing partnerships, collaborations, letting people get to know me and my vision for the work we're going to do, and also hearing about how others thought about it. Because I knew that it was going to be critical to work with a lot of different individuals and different entities to make this happen.
And I can tell you other institutions are calling and asking for our work because it really has taken our APT process and infused it with our core values, which include equity, diversity, and inclusion. So in closing, I want to thank all of you. Every one of you has contributed to our success this year. None of our achievements would have been possible without you bridging boundaries, drawing on diverse perspectives of your colleagues and coming together to accomplish amazing things. Thank you for attending today, whether in person or online. And I'll close with this video that highlights just how impactful our work is outside of our institution, highlighting some of the ways that news media have recognized the incredible impact that our School of Medicine teams are making in the world. You are making a difference, and I thank you.
A Today exclusive from Duke University's Medical Center.
Yeah, surgeons there have conducted a new groundbreaking procedure that's bringing hope to thousands of babies.
A Duke neurosurgeon now splits his time between a real hospital and one on TV.
Kevin Saunders is the director of research here at the Duke Human Vaccine Institute, one of the many groups racing to create a universal vaccine.
What do you think of this treatment and how big of a deal is this?
It's a huge deal. This would be the first available treatment to slow disease progression for this area of huge unmet clinical need.
A new drug for metastatic breast cancer just earned approval from the FDA, and it all started in a research lab at Duke.
It's the first new endocrine therapy for metastatic breast cancer in over 20 years.
Little Easton is so adorable, but I'm in awe of Dr. Turek and the researchers at Duke.
Dr. Kalu is with Duke Children's Hospital in Durham, North Carolina, and she says these kids aren't just coming down with COVID.
Much of the work being done today on COVID is built on the back of similar research on other viruses, influenza, HIV.
We've been working on an HIV vaccine now for almost 30 years.
Let's focus now on some of the questions being raised about how the gunman was able to obtain weapons after those 2019 incidents. Jeffrey Swanson studies these issues. He's a professor of psychiatry and behavioral sciences at Duke University.
Yeah. He'll grow into that part as he grows, right?
His valves grow with him now.
It's incredible. That was an incredible
Brilliant
story.
doctors,
yes.
courageous parents, strong little baby.
Yeah, totally.
I hope that makes you all proud. It certainly makes me proud. So thank you again. And thanks for coming.